Good morning. It's time to get in touch. In Touch is a public affairs show dedicated to improving the lives of Susquehanna Valley residents. I'm Freddi Hammer, news director at Backyard Broadcasting. Well, October is Breast Cancer Awareness Month, and at this time, we are still very concerned about breast cancer and the risk factors, and we want to make sure that people in our family, ourselves, we're taken care of, and of course, taking care of the different kinds of lifestyles that we need to pursue in order to keep those risk factors low when it comes to breast cancer. Today on the phone with Dr. Jacqueline Oxenberg, Geisinger Surgical Oncologist. Good morning, Dr. Oxenberg.
Good morning. How are you?
Really good. Thanks so much for joining me today and taking the extra time.
Thank you for having me.
Well, tell me a little bit about the risk factors when it comes to breast cancer. And we are here in October Awareness Month, and lots of people thinking about, hey, maybe I need to get an appointment. You do have some telephone screenings available that we'll talk about today. But tell me a little bit about the risk factors when it comes to breast cancer. How should we be thinking about this?
So breast cancer is very common. On average, it occurs in about 1 in 8 women. Obviously, the sooner that we can find it, the better. And early detection is crucial. There are multiple risk factors for breast cancer, including our own hormonal exposures, sometimes our medications, as well as a lot of genetic risk factors. And that's what we hope to address during our screening event on October 17th.
It's a really wonderful thing that Geisinger is able to do with a October 17th day. The whole day is going to be 15-minute appointments for folks to call in. It's open to anyone.
Yeah, so what we're doing is we're offering free screening for risk factors for breast cancer to determine if somebody is truly high risk. Obviously, this does not replace screening mammograms, and screening mammograms are crucial to early detection. But what we are offering that day are screening to determine if somebody is truly at increased risk for breast cancer. Patients, can register for this, and it is free. There will be consultations over the phone, and there's a calculated risk model that we use based on factors that we will obtain prior to the appointment.
If this program, as it helps with folks stay at home and get these concerns addressed right over the telephone, are there opportunities if there are no more spaces or something going on in the future? Are you able to have the same kind of conversation with your regular physician at Geisinger?
Yeah, so this was kind of an opportunity to put it out there that we should be looking for people that are high risk. Mm-hmm. We have multiple places, including our breast clinics here and across the Geisinger system, that have the capabilities to calculate out these risks and place the appropriate referrals. The idea is that the word should get out that if anybody's worried, if you have any family history of breast cancer, you have your own risk factors that you're worried about, that you have somebody to go to figure out, are you truly being screened the appropriate way with your annual mammogram, or are there additional things that should be done? If somebody is higher risk or there is a concern for a genetic component, we do offer these screenings even just by referral through our clinics, which, we can calculate out the same risk, we can have the same consultations, and we can also send people to the appropriate places to get genetic testing or even discuss risk-reducing measures.
This opportunity is for any woman 18 and older. How about men? Are you able to talk to men in a high-risk category? Maybe they know or maybe they don't?
So that's a great question. So our risk models don't really cover, are not really validated with men, at least as far as I can say. But I have to say that men can call. Men can also get breast cancer, and that is a very important point, especially when it comes to hereditary or genetic predisposition, which if a male does get breast cancer, we are automatically testing.
What is the time factor between a telephone call with a high-risk patient and maybe getting the next step, coming in for an evaluation? So
anybody can register. The link to register is geisinger.org/breast-screenings. And this website will be open. Once you do click on that, then it will say that you have registered and you will be sent an information form. This information is critical for us to put people through an accurate risk model and determine what the risks are for breast cancer for that individual person, as well as determine if a referral to a high-risk clinic or cancer geneticist is appropriate. Once that information is received, then people will be sent an appointment, and then the 15-minute appointment on the 17th will be to discuss those results, what it means, and who the person should be referred to. So it's a lot of some of the work is behind the scenes, but the 15 minutes is really dedicated to really talk about what those results mean and who should be referred, or even reassured that they're doing everything that is correct.
At what point do you come into the teamwork to find out a little bit more about what's going on?
So we have a whole team of people that will be offering these phone meetings. There will be multiple surgeons, including breast surgeons or a surgical oncologist. Mm-hmm. We also have our high-risk providers and nurses that typically do also discuss these results with people. We also have cancer geneticists. So we are all part of that consultation team. It's just we are all different components that of the team that make that up. So my specific role is really discussing what can be done to reduce the risk, or even performing some risk-reducing surgeries or treating people to reduce the risk. But there are multiple different players in the team, and we're all participating.
That is just wonderful. I mean, as far as following your dream, was this something that when you knew you were going to be a doctor early on, was oncology something that you were moving toward in general, or have you been moved toward this area in your career?
So surgical oncology is something that I was interested in. I originally was interested in research. I really enjoy the innovation, the trying new treatments, trying to progress medicine, providing the best care. And by going into surgical oncology, I'm able to do both. I can be innovative. I can research. I can get patients on clinical trials. I can do new techniques. And I also have the opportunity to cure people, which is very rewarding. Here, coming to Northeast Pennsylvania, I really, doing training in multiple different major cancer centers, I really wanted to bring that care locally to our patients here, which I think we more than do here.
I think Geisinger is on the cutting edge, and really have been for a very long time in Pennsylvania as far as medicine goes. And you say breast cancer is more of a common occurrence, and that innovation is allowing people to have a little more hope, isn't it?
It is, yes. Breast cancer is very common. Actually, the average risk for a person is about 12%, which, is not something that we can say about a lot of cancers. So, so it actually gives us the opportunity to really study new things.
I have had one mammogram. I'm just over 50, and I was very surprised at the lack of pain that a mammogram brings on. It is absolutely painless.
So we also do offer 3D mammograms, or what's called tomosynthesis, which is really which is not as painful as a standard mammogram, and actually helps with imaging, especially for people for dense breasts.
Okay.
So, yes, they're not as painful as they used to be.
I did actually talk to a girlfriend, I think on Facebook from high school. She says, and she's a very thin woman, but she has dense breast tissue. And that's something that I didn't even realize. They have to go in for more screenings than normal.
Yeah, so Pennsylvania had recently passed a law requiring insurance companies to pay for additional imaging for people with multiple risk factors for breast cancer, including sometimes dense breasts, which can increase your risk. There are some reservations about widely doing that, but we do treat people and do follow some people with dense breasts that may have other risk factors as well closer. So it is a well-recognized phenomena that dense breasts can be a problem.
Well, thank you, Dr. Oxenberg, for offering this breast cancer risk screening coming up October 17th. Could you tell us one more time how we can get involved to register?
Yeah, so you can register online. Again, it's free. It's at geisinger.org/breast-screenings. Just go to the website, click on the link, and then please fill out the information sheet. We'll have a phone number there in case people have problems with that. And then people will either be called or emailed with their appointment, and then we'll talk to them on the 17th.
Sounds good. Dr. Jacqueline Oxenberg, Geisinger surgical oncologist, located right here in Northeast Pennsylvania, and we're just so grateful to have your expertise here. Thank you, Dr. Oxenberg.
Thank you.
InTouch is locally produced in our studios at 1685 4 Mile Drive in Williamsport. To get in touch with us regarding questions, comments, or topic ideas, call weekdays between 8 and 5, 570-323-8200. You can also write to us at 1685 4 Mile Drive, Williamsport, PA 17701. Attention Freddi Hammer. Or email me at fhammer@backyardbroadcasting.com. For archived programs of our InTouch series, you can subscribe to our YouTube channel, Backyard Broadcasting. Each current weekly program is featured on the Backyard Broadcasting websites. Thanks for listening to InTouch, a production of Backyard Broadcasting.